Invitations can change your life. How you respond to an invitation can change the course of your life. Welcome to HEARTtalk with me, Dr. Charles Lee. After 42 years as a medical doctor with 35 years of experience as a plastic surgeon, I have faced real-life issues in health with open-heart bypass surgery, a financial crisis, and yet went on to earn R1 million within 5 years. Struggled through relationship and spirituality issues on my journey to live my best life. So if you are searching for real-life solutions to real-life issues, then join me at the HEARTtalk podcast for insightful interviews, heart-to-heart conversations, and selected book reviews. And together, let's talk. I've been working for 42 years, and I've never ever been in a situation like this right now, where we're living through a crisis. It's affecting me personally, my work, and everything around me. And I'm sure it's affecting you too, because these are facts of life that we all have to face every day. And so I'm so delighted that joining me at this table talk, having a conversation over lunch, is the point man of COVID right now. And he is none other than Dr. Timothy William. And as I continue to invite him in to join me, it is important for you to understand that Tim is really the man on the spot, okay? He's an expert on infectious diseases. He's based here in Gleneagles Hospital, and both of us are here in Kota Kinabalu. And it's a pleasure to have Tim, and I want to welcome in Tim. Hi, Tim. Welcome on board.
Hi, Charles. Nice to see you, Charles.
Now, nice to have you. I mean, you know, we have lunch all the time, and you know, this is a table talk conversation with people who have a pretty good idea of what COVID is all about. This is a crisis of our time. And you know, Tim, I want to just start while waiting for more people to join us, Tim. I want to tell you a short story to take you back 40 years. And for those who have just joined us on Facebook, 40 years ago to date, Tim, 1981, I was doing my military service in Trendak in Malacca. And I still remember we were in this truck, and all doctors, there were about 18 to 20 of us. And we were coming back after a recce in town. And then suddenly there was gunfire. Ambush, smoke bombs, you know. And this was something that we all got caught by surprise. And then we didn't know that the driver had taken the truck into an area which was planned for an ambush, a mock attack. And so we jumped off the truck, got into all the trenches. And lo and behold, all my colleagues were pointing rifles at each other, and we had to push it away, you know. And the commander came in to recce to see the whole situation. And he said 4 words, Tim. I will never forget those 4 words. All of you are dead. Because we had no sense of understanding what it is to be in an ambush and what it is to be on attack. And so 40 years fast forward, today, we are living in a battlefield. Today, we are in an area of time where we were never prepared. And it's so wonderful to have you join me at this table talk, and for others to come on board to try and understand a little bit more about what we are facing in this COVID-19 pandemic. So welcome, Tim. And allow me to start, Tim, by asking you, in your treatment, personally, your treatment of COVID-19 patients, give us a sense of feel when you put your finger on that pulse. Take us into that room when you see your patient. What's it been like for you?
Well, thank you, Charles, for a very good introduction. And it looks like you yourself have gone through very difficult times, especially when you're in the army. So a lot of what I'm experiencing now is probably what people in the army and people in danger would have experienced before. Although I can't say it's the same thing, but right. The sense of fear, the sense of uneasiness, none of us have ever experienced before. Charles, as a doctor, and I'm a doctor, we have never seen a situation like this where you have, even in our country, 50 to 100 people dying a day of infectious diseases, of an infectious disease. When I first saw my first COVID patient, they are different from other patients in the sense that many of them, this patient came in fairly well, smiling, and he can actually joke about things and say that he's well. Usually when you see a patient, usually when they come into the hospital, any one of us, when you come into the hospital, you expect to get better, isn't it? When you come out, when you're sick, you finally found treatment and you find yourself better. But it's not so much so in the case of the patients who have very severe COVID. They come to the hospital, just like this patient to me, looking apparently well. Ask how you are. I'm okay. I'm all right. I can breathe well. But when you look at the charts and the monitor, oxygen levels being very, very, very low, very low. So patients who are ill but do not feel ill. This patient was only about this in his mid 60s, in his mid 60s. This is just one of the many, mid 60s. He was feeling well. He thought he was going to get better, and I was fairly confident that he was going to get better. But the course that he had was protracted. And day to day, I would come and see him, talk to him, have conversations with him, get to know him. But as time went by, his condition slowly but surely deteriorated. Now, it's very, very difficult to see someone in front of you going down slowly and being totally aware that he's not doing well. And the thing about COVID is patients, unlike others, at least you have some form of family support. Can you just imagine if you are sick and your son can't visit you, your wife can't visit you, your family members can't come and comfort you, and you're all there alone. You can't even see the face of the doctor or the nurse because we're all covered up. You're totally isolated. Totally isolated. So they need a lot of emotional support. And Charles, you asked how it affected me. Of course, it affects the patient a lot. As a doctor and as a caregiver and as a frontliner, the feeling is heart-rending. It's heartbreaking and it's surreal. Now, as a doctor, we always want to do good for our patients. And to a certain extent, in many patients with COVID, they come out well, they come out better, but there's a small subset of patients who do not do well despite everything that you do. Despite every medication that you do, the person continues to deteriorate. And that to a doctor and to the people around, and also to the patient and the family member, that's the worst kind of feeling. And you know about COVID, the patients, just 1 week ago, they were well, they were smiling, they were with their family, and when they were first diagnosed, they think everything is all right. But within a space of 6-7 days, from a period where you think you're all right, then you come to a stage where you're gasping for air, you are short of oxygen, you're on high flow oxygen supplementation, and then you realize, and people realize that you're not going to make it, despite everything that's being done. And in this day, in modern medicine, we seldom encounter this. We do, but not at this level, at this scale of the tragedy that is occurring in the world, in our country every single day is unimaginable, Charles. And it's what I'm going through is being played throughout the entire country. Only thing, doctors are seeing more patients in other hospitals in West Malaysia, more and more patients and families. Some are brought in dead, brought in dead. Younger people being brought in dead. This is something that is unheard of, at this scale. In Malaysia alone, every day we see about 50 to 100 people are dying of this disease. You don't see this for any other infectious disease. So personally, for me, Charles, you ask me, it is heart-wrenching. It is heart-wrenching, not to me, but to the nurses who are taking care and to the thousands of frontliners who are taking care of COVID patients being faced with this every single day. It is very, very difficult. Very, very difficult. And I'm only talking about myself, Charles, but not to mention the family members. It must be much worse, Charles. Much worse.
No, I take your sense of trouble. As doctors, we always come to work in the morning hoping for the best, that we can give our best. And when you're faced with a situation where you feel helpless because the disease has taken over control, and you and I are only guided by science, It's not about figures that we see every day in the newspapers, in the media. It's all about percentages and how many are getting this and how many are positive. You cannot run away from the figure of death, isn't it? Because that is the mark of whether we're doing well or we're getting better or we're just at status quo. Now, Tim, when we look at all these figures, Tim, I mean, you are frontline. You got your finger on the pulse of a COVID patient. I mean, I myself, we don't see COVID patients, but we're always conscious, right, Tim, where we are. But when we get a message, I got a message just 2 weeks ago from a colleague of mine, and whom I've known for the last 10 years. And the message is, Doctor, I just lost my dad to COVID. And then suddenly it becomes very real that death can happen to me, it can happen to anyone that we are facing with it. So tell me something in your experience as an infectious disease expert over the years. How do you put COVID against all the other diseases that you have been treating?
Okay, now let's just compare with infectious disease that we are very well aware of. It's dengue fever.
Sure.
Now, in dengue fever, in the worst year in Malaysia, we lost 300 patients. That is considered the worst in 1 year. I think it was about 4 or 5 years where we had a dengue outbreak, where 300 people died of dengue in the country. 300.
Right.
Now, in COVID alone, since March of last year till this year, that's about 15 months, more than 4,000 Malaysians have died of COVID. Now, in dengue fever, you have one person in the family dying. In COVID, you have the husband and the wife dying, sometimes a child. The entire family, half the family dies. So you just compare. We always think of dengue as being one of the worst diseases that we have. We're also fearful. 300 on the worst year. In COVID, we have more than 10 times the number of people dying of an infectious disease. Of course, people die of all sorts of reasons, but I'm talking about infectious diseases.
Sure.
Where infectious diseases are different from others. Infectious diseases is people start out being well. You're well, you get infected, and within 2 or 3 weeks, you're dead. So it's very different. Now, since we are in Sabah, let's talk about another infectious disease, malaria. The highest number of malaria cases in Sabah was around 1995, where we had around about 50 over 1,000 people with malaria.
1995, okay.
1995, 50,000 people had malaria. And even then, at that height, we hardly had more than 50 to 100 people dying. I think even less, actually. Malaria disease that all of us are familiar with here in Sabah.
Sure.
COVID alone in Sabah, alone, since in March of last year, we had 66,730 cases in 1 year alone, with 510 that's 510 deaths, Charles, in 1 year.
Yes.
You see, in 1 year. In a bad year of malaria, a bad year would give you about, at the most, 10 deaths, and that will be discussed. COVID, we already have nearly 500 people dying. So this disease is like nothing that we have ever experienced before as a nation, as a people in this world. And it's shared. It doesn't matter whether you're poor, or whether you're rich, whether you're American, whether you're from the United Kingdom, whether you're from Africa. It doesn't matter. It doesn't matter your color, your religion. It doesn't matter how wealthy you are, how rich you are. It cuts across all boards, and it's a shared suffering and a shared tragedy that the entire human race is feeling. How we treat COVID here in Malaysia is the same as how they treat COVID in the United States and the UK. It's the same everywhere. And treatment options are limited. Treatment options are limited, Charles. You see? So
it's evolving. It's evolving all the time, isn't it? The whole situation keeps to be changed. There are U-turns, and so how do you, as an expert specialist coming to work, when today you may be faced with and fed with some information, and tomorrow it might be changed? I mean, how do you prime yourself up to face this enemy. It's an invisible enemy, Tim.
Yeah. Well, the virus is malevolent, malevolent.
Mm-hmm.
It changes, it mutates, it tries to escape our immune system. And as you know, now there are variants that are more resistant to the vaccines that we have. Variants
Right.
that are coming, variants of the viruses that can come and infect people who have already been infected by
Mm-hmm.
COVID-19. So
Right.
this is a very wily virus, and I tell you what I see, what we think we know today, in a few months' time it'll change. But
Right.
thankfully, one thing good is we have a lot of scientists now. Our technology is good. It is a battle between us humans and the virus.
Right. Yes.
So we do know a lot of what we didn't know about the virus 1 year ago, but even that is not enough. So, because science is
Mm-hmm.
always the quest for knowledge, knowledge is never
Right.
static. So, it's never static, isn't it? Knowledge is
Mm.
never
Yes.
static. So we are always bombarded with information about COVID from the internet, from WhatsApp, from Facebook, from everything,
Yeah,
from
it's never
scientists,
ending.
and even among the scientists, they don't agree with each other. So
Right.
understandably, people can be confused. But as you say, Charles,
Mm.
at the end of the day, it's the bottom line, isn't it? How many people are dying of the
Yes.
virus? We can say
Correct.
whatever
And
we
that's a
say,
figure.
we can say whatever.
Sure.
At the bottom line is how many people are becoming ill, and there are people dying of this
Mm.
virus. And then we need to keep our eye on what is important and on the ball on how we can
Right.
avoid ourselves from getting this infection and how we can treat it.
No, I tell you, Tim, we are actually so blessed and fortunate that we have you right here in Glen Eagles with us. And for those of you who have just joined in, welcome to Heart Talk. With those of you who have just not heard about our podcast before, you can get us on our website hearttalk.com.my. So thank you for joining in. We are at the table, and at the table we've got the man, the point man for COVID right now is Dr. Timothy William. And if you have your questions, please be free to comment, introduce yourself, give us your website, give us your address, your email address, so that we can keep in touch with you. And you may want to have some questions. Now, Tim, during this table talk, I've got a mailbag full of questions that have been sent in. So what we're going to do is we're going to shuffle from the table to the bag, and
Okay,
then I'm going
sure.
to share some of the questions that were sent in. Now, coming to the fact about vaccines, I remember months and months ago, before we had even the vaccines at our table, um, we were all wondering when is it going to come, and finally when it has arrived, we are now given choices to choose, which is even ironical because I'm at an age where any vaccine will be good enough for me because of the severity of the disease, as you just rightly pointed out, because death is the end game, and this is an invisible enemy. So right now, one of the questions here is that do I get to choose my vaccine? Why is it that some are percentages 70, some are 80, some are 90? How does that affect the layperson? Or we just queue up and just take any vaccine that is available to us? Just give us your feel about that, Tim.
Okay. Now, Charles, I totally agree with your statement. Now, any vaccine is better than no vaccine.
That's
Any
right.
vaccine is better than no vaccine. So I would advise everyone, the ones that have the vaccines that have been approved by the WHO,
Right.
please take the vaccine as soon as possible, especially if you're in a high risk group. So any vaccine is good. Now,
Yes.
the
Yes.
question is which vaccine is better? Actually, to be honest, none of us know which vaccine is
Right.
better. We can
Right.
only compare vaccines when we do head-to-head studies. That means you compare vaccine A and vaccine B and how they uh, reduce the risk of a person getting COVID, or reduce the hospitalizations and death. So far, no
Mm-hmm.
studies have been done where these vaccines are compared side by side. All the
Right.
vaccines are compared is the vaccine compared to another group without the vaccine. So there's a lot of debate on which vaccine is better, and a lot of it is also influenced by our own biasness. Some people prefer
Sure.
the China vaccine, some people prefer the Pfizer vaccine because it sounds nice. But the fact of the matter is every vaccine is good, and my advice to you is to take whichever vaccine that is available, the soonest the better. Now, we cannot be waiting. You cannot postpone your vaccination because you want another vaccine. We do not have that luxury, and it's the same in many, many countries. In the UK, for instance, they're not given many of them are not given a choice. They're just given the Oxford, the Oxford vaccine. They had no choice. And when you are faced with a disease like that that's affecting millions, and vaccines are short in supply, if you the government having a program where people choose their vaccines is not going to be easy, and we are aiming to vaccinate people as fast as possible. So please, my friends who are okay, please take any vaccine as soon as possible. Do not wait.
You know, Tim, coming back to our table talk, you mentioned this particular patient who was 60 odd years old, and you had your finger on his pulse and you saw him, deteriorating. Tell me, as we move forward with the science and the knowledge, what was the age of your youngest patient? Because we now know that COVID is now affecting younger and younger patients. So the question is, what was the youngest? I mean, I believe that the infection can be quite severe too, right?
Yes. As now with the new Delta variant, it seems, although it still needs to be confirmed, younger patients are getting severe COVID. Now, the youngest patient that I treated was 32 years old, just recently treated, 32 years old and very young. And he came in with stage 4, almost going to stage 5 COVID. And his oxygen levels were very, very low. He had to be treated in the ICU for 1 week. His wife also had COVID, and he had to be treated alone. And with the experiences that I described, requiring high doses of oxygen, and he had to put himself in a prone position where you sleep on your tummy. For 1 week, he was very, very ill, but thankfully he slowly improved. But this patient, without the treatment in the ICU, he would probably have died. He was very close to death, and he's very, very fortunate. So just because a person is young, it doesn't mean that you will not get severe COVID. There are people who are even younger, even doctors who have died who are younger than that. Recently in Labuan, there was a nurse who died because of COVID. Which disease do you see? Which infectious hospital? Many young patients are also asked to go home and self-monitor. The problem with self-monitoring and home monitoring is you feel well despite your oxygen levels being very low. So that is the problem, and these are the challenges that our country is having. We don't have enough beds, Charles. We don't have enough beds in the hospital, much less we don't even have ICU beds. I hear people are being ventilated in the emergency departments outside the ICU because there are not enough ventilators. And if you look at the data, there are 900 over people in ICU, It's terrible, it's horrible. And hence the drastic measures that the government has to take to stem the infection, to stem the spread of this infection. Otherwise, there'll be a total breakdown, Charles. We haven't experienced a total breakdown in our healthcare system, and that will be a disaster. So young people, yes. Yeah.
Yes, when you talk about young people, I mean, even in my own home, all my 3 children are between the ages of 25 to 35. And if I were to flip the coin around and bring this statement to you, or this argument, or this aspect of it, we also know, Tim, that the younger adults, the younger age group, are also low risk, right? Compared to the ones who are my age. So if I'm 25 years old and if I am having a low risk, why should I take the vaccine? And yet you give a picture of the severity of the disease, even at a 32-year-old individual. So how does one balance this equation? If I am one of those group of people who are, 25, 28 years old, look, I'm a low risk guy. Why do I need to take the vaccine? How would you address that situation, Tim?
I think, low risk doesn't mean no risk. Low risk doesn't mean no risk, isn't it? The risk of severe infection doesn't only depend on the person's age. It also depends on other comorbidities, you see. One of them is if a person is obese and is 25 years old, has a high risk of getting severe COVID. A 25-year-old may also be pregnant, and that also increases the risk of severe COVID. 25-year-old may also have bronchial asthma and other diseases that also affect young people. And also, don't forget, the severity of the disease also depends on the virus. You may have a more virulent, or in the future, one of the more virulent variants that can affect younger people. And the severity of the disease also depends on the inoculum, the amount of virus that a person inhales. So if a young person inhales, or there's a high load of viruses entering him, there is also a higher risk of this person getting severe COVID. So that's one, for the person himself. The other thing is, yes, the fact that young people may not show many symptoms or may have mild symptoms also makes them easier for them to spread the virus to their parents, people who are older than them. So while it may be safe for you, when you go back, you give the virus to your parents, your mother and your father, or your grandfather, and they may die because of the virus. You see, many of the people who are in the recent Hari Raya, the recent Hari Raya celebrations, many of people got the infections from the children who are returning. So imagine you are getting this virus, you go home and you give the virus to your parents. See, so vaccination, how does vaccination help? Vaccination helps by reducing your risk of infection. So in turn, when it reduces your risk of getting infected, indirectly it also reduces the risk of you spreading the virus. There have been studies, though not conclusive enough, that a person who is vaccinated, let's say you're vaccinated and you still get the infection, the chance of you spreading the virus is there, but it's lower compared to if you're not vaccinated. So these are the two reasons. One is it reduces the risk of you getting severe COVID, and reduces the risk of you dying. And the other one is it reduces the risk of you spreading the virus to other people who may be in high risk, who may die, Charles.
Yes, sure. And this is the dilemma because, we're all living in this state now. Like I told you when I introduced the whole session about the time when we all dived into that trench, it was a kind of a lockdown, even at that time, 40 years ago in the army. So today we are all faced with these do's and don'ts. I just went for my usual weekend walk for 3 hours, and I was looking behind my shoulder, wondering if I will have a summons, or will have to pay some fines and all that. So when you talk about do's and don'ts, and I'm still concerned about the younger age group, why should I wear a mask? I mean, if I'm low risk and, so in fact, coming back to the mailbag, Tim, I've had my vaccination. I've had my 2 doses. Do I still need to wear a mask? And can I still get COVID infection?
Okay. First of all, Charles, I have to state that many of us, all of us, are really have COVID fatigue, right? COVID fatigue.
Absolutely.
Here, day and night, morning, and it's difficult on all of us, more so for others. Especially the young people and the children, especially. They can't go out. I mean, when was the last time you saw someone smile when you went out, when you went to work?
I was just going to mention, that's right.
That affects us psychologically. You go, you don't see people smile, you don't see their expressions. It's like going and meeting strangers, and it is not easy. Now we have to admit it's not easy. Now, when we started wearing masks, we didn't realize that we would be required to wear masks for more than a year, isn't it? Even as a doctor, wearing a mask at work is not easy, much less the public wearing masks every day when they go out, when they go to the shop, when they go anywhere. Now, wearing a mask is essential. It is very, very important because it prevents a person from spreading the virus and also reduces the risk of them getting the virus. So it is very necessary for people to wear masks whenever they are in public places, and especially so when they cannot social distance in buildings when they are close. Okay, I have to admit, it is not easy. It's not easy for all of you all in the audience to wear a mask. But it's something like, Charles, you mentioned, we are at war now, we're at war. And in war, we have to accept there will be difficulties, there will be inconveniences, there will be sacrifices that are being made. So we have to sacrifice our personal liberties this time. It's not easy. It's not easy. On the other hand, Charles, we also have people who are overly judgmental.
Yes.
There are also
Yes.
some
Who don't
people
they know?
overly judgmental. They are virtually. I call them virtue signalers. You don't wear a
Yeah. Right.
mask, you're a bad fella.
Yeah.
When let's say you're alone, you're jogging, you don't have to wear a mask when there's no one around. If you're on the beach,
Right.
you're walking, you don't need to wear a mask.
Right.
But what's most important is you remember to wear the mask when you should. You see?
Yes.
So
Yes.
I do see people walking in the beach wearing a mask, walking alone. This is not necessary. Uh,
Mm.
the problem is people. Why is it that the government has a blanket mask mandate? Is people can't expect common sense from people sometimes. There are
Right.
two groups of people. One is they insist on you wearing a mask everywhere, and then
Yes.
there's another group of anti-mask people who will say, I'm not going to wear a mask under any circumstance. So
Right.
we have to be reasonable.
Yes.
We have to
Yes.
be
Yes.
reasonable and encourage
Okay.
one another. And it's not easy to get a mask also, Charles. I mean, for us,
Yeah.
people who can afford it, you can buy a mask anytime. What about people who can't
True.
buy a mask? It's not that you can get it anywhere, you
Yeah.
see.
True. True.
So
And
we
and uh,
have we
and
have to wear a mask, yeah.
and talking about wearing masks, now we are told to wear two.
Yeah. I think, Charles, you mentioned about being vaccinated, right? The
Yes.
question is, now that
Yes.
you have
That's
been
right.
vaccinated, I've been already vaccinated, why
Mm.
should I wear a mask? Okay, now if you're vaccinated, the chance, like I said, the chance of you getting the virus and spreading is much less. That's very good. The mask
Mm.
actually gives added protection. So the
Right.
question is, why should we wear a mask when we are vaccinated?
Mm.
I agree. The need for the mask after you're vaccinated is of course less, but I would argue that it's still necessary as of this moment because of the new variants, and also
Right.
because we are not really certain on how our immune system will react to these new variants despite being vaccinated. We
Right.
do know that there are some vaccines that have already been tested on the new variants, which shows that they are effective, but they are
Mm.
less effective compared to the original COVID-19 variants. So
Mm.
the fear is that if we are not careful, we will be in a situation again where the vaccines are ineffective. You have variants that can sort of fight against the vaccine, and there will
Right.
be another spread, another
Mm.
surge. And
Sure.
I think all of you agree we cannot tolerate these lockdowns,
Yes.
repeated lockdowns, right?
Yes.
We
Yes.
cannot tolerate
Yes.
repeated lockdowns. There has to
Right.
be a solution. And if that solution is vaccination and wearing a mask, I think it's a small sacrifice compared to being locked down in your house, not being able to work. Small
Right.
sacrifice compared to being in the hospital and dying, even though it may not make sense, right? There are
Yes.
not many things that make sense, even though it
Yeah.
may not make sense. As Anthony Fauci and many people have said, let's just be patient.
Mm.
Even if we don't understand, even if we don't agree, even
Mm.
if we don't agree,
Yes.
let us try and fight this battle together, lah, you know.
Yes. Yes. And I know coming from you, um, this is pointedly right time for us to listen to this message because, I mean, all said and done, it's a difficult time for all of us. And when we talked about all that we were going through and the frontliners and and you yourself and you've seen the amount of heaviness of heart that medical workers go through. One of the questions was brought in just now from the mailbag. How can an individual support the medical field, the medical people out there, the frontliners? How can they support and be of help to these people?
I think uh, first of all, try not to get the virus, lah. Try not to get infected and spread.
Mm.
If you really think about it, uh, there's only a limit to what the government can do to avoid a person from getting COVID. You see,
Mm.
the individual and the community have to play a role in trying to prevent getting infected and spreading. So to the question, how can you help the frontliners? You can
The
help by not
frontliners, the
getting
medical
COVID.
workers.
Yeah.
Yeah.
Yeah, you can help by not getting COVID, by trying your best to stick to the standard operating procedures to prevent yourself from getting COVID and also spreading. You
Mm.
notice, Charles, many of the cases have come from clusters.
Mm.
Clusters, I can understand workplace clusters, they may not be have been avoidable because people need to work to earn a living. But a lot of the clusters have come from gatherings, religious gatherings, celebrations, wedding, and recently the Kaamatan. And this creates clusters and more patients have come in. And this creates
Mm.
more stress on the healthcare system and in the front line. So
Mm.
you can help the frontliners uh, by doing this. Now, on the individual level, when I was working, I volunteered to work in Queen Elizabeth for 3 months, Queen Elizabeth Hospital for 3 months. What
Mm-hmm.
I found very encouraging was the public used to send food and pack food for the staff to eat. Not that they didn't have food, but the thought that they cared for the frontline workers actually helped a lot. And
Right.
if you're in the public, you can also help by encouraging the frontline workers and their families as well. Just saying a word of thank you to them for
Right.
for the sacrifice that they are making
Absolutely.
to serve our
Absolutely.
country. That will just be enough. And it is quite sad sometimes when you hear uh, people, the frontliners, bearing the brunt of the public's frustrations with the government.
Yeah.
So they're frustrated with the government. They take it out on the
Sure.
frontliners. The
Yeah.
frontliners are working day and night, screening
Mm.
patients, vaccinating patients, treating patients,
Yes. So we
taking care.
know. Yeah.
And when the public and when people say you're not doing enough, it hurts them. It hurts them. I mean,
Sure.
there's a role for politics, I suppose. You can criticize
Yes.
the
Sure.
government and politicians,
Yeah.
but let's not, criticize the Ministry of Health. And people are really
Mm.
actually trying their best in
Yeah.
this
Sure.
it's situation that is impossible.
Yeah. 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 I mean, the correlation of, as I said, the battlefield. It's a war. And in a war, the nation
Yes,
goes to war. So you can't have the frontliner, the guy that's carrying his rifle in the front, be blamed if he gets shot down. You see, so
yes, yes,
it's a collective ideology of winning that's going to get us through, isn't it?
yes.
And so this is it. But again, I've got a number of questions that are coming from the younger people, and that is, Dr. Timothy, I'm 28 years old and I'm lining up and hope to get my vaccination soon. What is the long-term effect of this vaccine on me? 5 years, 10 years, do we know? And am I ready to face it in the next 10 years, what this vaccine might do to me? How would you navigate through this question, Tim, and help them understand that at
Okay.
this such a time as this, we have to be ready to take it?
Yeah, I think I can understand because there's a lot of news out there on the long-term effects of the vaccine. First of all, the long-term effects of any drug or any intervention for that matter is not
Mm-hmm.
easy to determine. For instance, if a person gets cancer, a person gets an autoimmune disease, there are many, many, many factors that may have influenced or given predisposed a person to get a certain uh, um, disease.
Right.
So now, what is the long-term effect of the vaccine? It means to say what will happen in 5 years or 10 years from now from the person with the vaccine. We actually don't know because
We don't know.
studies have already shown, studies have only been done for 3 to 4 months, and now we have about 1 year of data. So all I can say is in the 1 year period,
Mm-hmm.
very, very few side effects have occurred in people who are vaccinated. But
Mm-hmm.
one thing you want to keep in mind in terms of medicine, in vaccines, if a person doesn't develop a side effect within 3 months, they're very, very unlikely to develop a side effect after 3 months. generally speaking. So if you have an adverse reaction to any drug or whatever, it usually occurs within 3 months. Okay, it usually occurs within. So if within 3 months it doesn't occur, it's probably not going to occur. Okay, it's not probably not going to occur. And now, in the beginning, when the vaccines came out, we didn't have much data, but now we have more data, more than what we have roughly about 7, 8 months of the usage of the vaccine. And so far, the risk of developing an adverse event is very, very low. It's not zero. It is not zero, Charles, but it's very, very low. It's very, very low. I think people may want some figures, right? Now, if you get a vaccine, what is the chance of you getting a severe allergic reaction? Severe allergic reaction, a life-threatening allergic reaction. The chance of it is 7 in a million. Okay, 7 in a million. Yes. On the other hand, if a person gets COVID, generally across all ages, the chance of dying can range from 4 in 1,000, 0.4%, 4 in 1,000, and in some cases, 1 out of 100 chance of dying of the disease. So you have to compare the risk of the vaccine and the risk of dying when you get COVID.
Right.
See, so that's what young people need to know.
Yes,
See,
I mean that's
now
a
you may
side
not
effect
get
to
COVID
everything.
now. You may not. I think what's important is the information. I believe strongly in individual autonomy of choice, and that is one of the hallmarks of medicine, medical ethics. That each individual is autonomous, has autonomy, and has the right to make their own decision after being told on what the risk and the benefit is. So the government cannot force a person to take a vaccine, and neither would I. I won't force someone to take a vaccine, but I'll explain the risk and the benefit, and people have to take responsibility for their own decisions. So, 28-year-old man, you wait, this is what I told you, the risk is 7 in a million, and I've told you the risk of a person dying of COVID. And now, having weighed this risk, you decide whether you want the vaccine or not. I'm not going to force you, okay?
True. Now, talking about side effects, I always tell everyone that everything that you take today, whether it's a tablet, I mean, in my field of plastic surgery, aging itself is a side effect of living. You can't run away from that side effect. So no matter what it is, we should go out there, get ourselves vaccinated. And when we talk about the whole country and all that, tell us something about this herd immunity, because there's some of them who are just waiting for everybody else to get vaccinated so that they can be covered, you see. Are we heading towards that direction?
Well, we hope that we can reach herd immunity. Now, what percentage of the population needs to be vaccinated or immunized or infected, have some form of immune system before you get herd immunity? We are not really sure. It can range from 60 to 80% before a person gets herd immunity. So I think to the audience, many people may not know what herd immunity means. Herd immunity is actually a situation where people who are not vaccinated, who are not immunized, are protected by people who are immunized. So when we say 80% needed for herd immunity, it means that these 80% who are vaccinated, it will be enough to reduce or prevent the 20% who are not vaccinated or not infected from getting the virus. Why is herd immunity important? It's because not everyone can get a vaccine. It's not possible for everyone to get a vaccine, even if they wanted to. And there are certain proportions of certain groups of people who may not be able to be vaccinated. They may have severe allergic reactions. They may be very immune suppressed. They may take immune suppressive drugs, and they may not mount an immune response. So herd immunity is important for people who can't be vaccinated. So coming back to your question, Charles, can we achieve herd immunity? Of course. We have achieved herd immunity in many other diseases. We have achieved herd immunity in measles, measles, smallpox. So it has happened before, but it has taken time. It's not something that these diseases, herd immunity wasn't achieved in 1 year. So it's not easy for us to achieve herd immunity in 1 year. We hope that it can be achieved as soon as possible, but still the jury is out there, Charles. The vaccine is a moving target. It mutates, See.
And we just have to be on the front line of all that's happening and make use of medical science. And so coming back from the mailbag to our table talk as we wind up this session, what's your take-home message as we leave and we've just had lunch together, we've just had this table talk session? What would be your take-home message as the expert right out there in this particular field that is your bread and butter kind of work? What's your take-home message to all of us who are listening in, Tim? Where do we go from here?
The take-home message not only for you but also for me,
Yes.
This situation will not last forever. It will end. COVID-19 will not last forever. The virus will always be with us, but we will beat it. We will beat this disease. We will have to live with it, learn to live with this virus, and at the same time protect ourselves from getting infected and spreading this virus. So let us all, my take-home message is, let us all together as one human race in our country, consider each ourselves as our brothers and sisters, protect each other from getting this virus. We cannot fight this virus alone. We cannot fight this war alone. We all have to work together.
Well said, Tim. And such a joy to have you answer some of these questions and help us feel strong, because we can only get better, we can only get stronger, we can only get wiser as we, I was just telling my nurse this morning, my staff, I said, I haven't seen your face for 2 weeks now, And so she put it down and I said, okay, you're still my staff, and she put it back on. So hopefully we will come to a time where we can smile again. We can recognize each other's faces. We can start loving again in an environment that is conducive and warm. And we can continue to have table talk discussions on other topics other than this. So once again, Tim, I want to say thank you very much for your work, for what you are doing for all of us. I know that you are my personal physician and you are helping me to stay alive. And so I'm grateful to God for that. But at the same time, I must tell our audience out there that Tim is on our watch list group of doctors. And the moment he sends us something, everybody is red alert, And so we just want to thank you, Tim. And for those of you who have just joined us or you have been with us, never to worry, because this is recorded. It will be posted up on our website, hearttalk.com.my. Follow us on our Instagram, Dr. Charles Lee Podcast. You can follow us on SoundCloud. You can follow us on YouTube. We have a channel out on YouTube, Dr. Charles Lee, the Heart Talk Podcast. We just want to talk about the heart-to-heart conversations that matter to you and me. So once again, from all of us, let's talk again.